Good morning, dear students. Today we are going to discuss a very important topic of pharmacology, routes of drug administration. What is definition of route of drug administration? A route is the administration path by which the drug, fluids, poisons and other substance brought into the body contact. Broadly it is classified into three: parenteral, intral and topical. These are the channels by which drug is introduced to the body for achieving action. Now, the brief classification is systemic and local. The example of systemic is eternal and parenteral. Oral, sublingual, and rectal is example of eternal, and inhalation, injections, and transdermal is example of parenteral. Now, the injections are given by different routes: intravenous IV, intramuscular, subcutaneous, intra-arterial, intra-articular. In case of rheumatoid arthritis, in case of joint pain, the injection is given to the articulate bones, and intrathecal and intradermal. Intradermal is the route by which the hormonal preparations are given under the skin. Now, in this image, you can see the different route of administration. The parenteral intravenous, it is comes under two categories: large volume parenterals and small volume parenterals, single use and multiple use, ampoule and vial form. Sublingual, in which the drug is placed under the tongue and it is absorbed locally to avoid the first pass metabolism. For asthmatic patients, nebulization technique for inhalation, route of drug administration through nose and mouth, and transdermal, rectal, and topical formulations. Now, what are the advantages and disadvantages of oral route? Oral route is a very common route. It is very cheap, and self administration is possible. It is free from pain, and anyone can take medicine by this route. Absorption is take place through the GI tract, and it's very cheap if we compare with parenteral. Now the advantages are: first pass metabolism sometime deactivate the drug, so such kind of drugs are given by the other routes, and the drug which can cause the gastric mucosa irritation, it causes the feeling of nausea and vomiting. Disadvantages are destruction of drug by the gastric acid and digestive juices, and it sometime in emergency cases we cannot use oral route because effect comes very slow. If we compare with the parenteral route gives very fast action. In case of emergency, we give drug by the IV route, and also it has the 100% bioavailability. What is bioavailability? The amount or the fraction of drug which is available to the body for giving action is called bioavailability, and we can see the 100% bioavailability in case of parenteral formulations, in which the drug is directly goes to the systemic circulation to avoid the first pass metabolism. And the drugs which are unpleasant in taste can cause vomiting, and we cannot give drug to unconscious patients. Now we understand what is first pass metabolism. Whenever we take drug from oral route, it goes to the GI tract and absorbed, and before going to the blood, it passes first time from the liver. It's called first pass metabolism. Some drugs are deactivated, or some drugs are metabolized by the liver before going to the systemic circulation, so drug is not able to give action. So such drugs are given by parenteral route. For example, oxytocin is not given by oral route, it given by parenteral. Now the examples of oral doses form, which is given by the oral route: tablet, capsules, liquid solutions, suspensions, syrups and elixirs. These are the solid or liquid doses form. It is given in the form of syrup, tablet, capsules by the oral route, and self administration is possible, and it is most convenient, and mostly we use oral formulations for oral route of administration. Now, sublingual route. Here in this image, you can see drug is placed under the tongue and it is absorbed by the sublingual mucosa rapidly. And we use this route to avoid the first pass metabolism. Now, advantages: it's economical, quick termination, first pass is avoided, drug absorption is very quick. Disadvantages: irritation of oral mucosa, large quantities not given by this route, and few drugs only absorbed by this route. Now, here in this image, we can see the root of buccal cavity. The drug is placed under the gum and inner lining of the cheek. It's called buccal pouch. So, drug is placed on buccal pouch and it is absorbed slowly. So, it takes time to absorb the drug for giving action. Now, the advantages and disadvantages of buccal route: it avoids the first pass effect and rapid absorption is there, and drug stability is there. And disadvantages: inconvenience and advantage: loss of solid. If drug is swallowed, the action is not committed. Small dose limit: we cannot give the large dose by this route because the buccal space is very narrow. So only the small tablets and a small amount of medicament can be placed under the buccal route. Now we talk about the systemic or parenteral route. Parenteral administration is injection or infusion form by means of needle and catheter inserted into the body. It needs needle and syringe. It is comparatively expensive, and the term parenteral comes from the Greek word. Para means outside, enteron means intestine. The drug directly goes to the blood circulation for giving action, and it has 100% bioavailability. It is used in the emergency condition and in case of unconscious patients. Now, systemic parenteral examples are injectables, intravenous, intramuscular, subcutaneous, intra-arterial, intra-articular, intrathecal, intradermal. There is one more route for lungs in case of asthma, the nebulization technique and the asthma pumps. So this is the route for lungs, inhalation route. Here you can see the different layer of skin: epidermis, dermis, subcutaneous, and this is muscles. Veins are present below the subcutaneous tissue in the muscles, and intramuscular injections are given at angle of 90 directly from the muscles, and subcutaneous is given to this layer, and intravenous is given to the vein. To find out vein is very important in case of intravenous injections, and mostly the oil based injections are given in the intramuscular route. Comparatively, the fast action we achieved in intravenous route, it's very fast and bioavailability is 100%. Here you can see the single use ampoules of injections, and while it is for multiple uses for 20 or 30 ml, and we can use for multiple times. And here you can see the infusions: RL, Wrangle lactate solutions, dextrose, D10, D5, glucose bottles, and this comes under the large volume parenteral. It is used in case of dehydration or in case of hypotension for management of blood pressure. Here you can see the different part of ampoule. It is single use ampoule, and this is IV set. It is used for large volume parenterals. Now the advantages of intravenous injections: 100% bioavailability, large quantities given, and in case of unconscious patient, we use this route of administration. First pass metabolism is avoided, and such kind of drugs which can causes nausea, vomiting, or gastric mucosa irritation, we avoid this. Now disadvantages: it is expensive, a trained person is required, no common man cannot self administer the drug, and it is expensive because it needs syringe and needle. And now we move to the intramuscular route. As we have seen, the location of intramuscular at 90 angle at the muscles, glutide muscles or deltoid muscles is very common site for this injections, and especially the drugs which contain the oil base, it is given intramuscularly. Now the subcutaneous route, this route injects the drug under the skin. Absorption is very slow, so the action is very prolonged, and implants are there. Porous capsules are inserted into the loose tissue by incision of the skin, and it is stitched up. Example, certain hormonal drugs and insulin patches are available for this route. Intra-arterial, it is very rare, and anti-cancer drugs are given for localized effect, and drugs used for diagnosis of peripheral vascular diseases. Now, intra-articular, these injections used in the location of joints. Injections of antibiotics and corticosteroids are administered in the inflamed joint and the cavity by the expert. It is only given by the experts. For example, hydrocortisone in rheumatoid arthritis condition. You know what is rheumatoid arthritis? It's an autoimmune disorder characterized by the joint pain, especially at the knee site, because the overall load of the body comes at knee. Intradermal, drug is given within skin layer, dermis. It's painful, mainly used for testing of sensitivity of drugs like penicillin and anti-tetanus serum. Chickenpox vaccine are given by this route. Now, topical route of administration. Topical route of administration is the application of drug directly to the superficial part of the skin. It includes the administration of drug to many mucous membrane like eardrops, nose, lungs, vagina, urethra, colon. Topical doses form are creams, ointment, lotions, gels, transdermal patches, solution, suspension, ointments, and drugs for spray and powder form drugs. These comes under the topical administration. Now, what are the advantages and disadvantages of topical route? Topical route give the local therapeutic effect, not well absorbed into the deeper layer of the skin and mucous membrane, and lower risk of side effects. Transdermal route offers a steady level of drug in the system. Spray for inhalation through the nose may be local and systematic action. Route of administration, time. The fast action comes under intravenous route, 30 to 60 second. It's very fast. Intrathecal 2 to 3 minutes, inhalation 2 to 3 minutes, sublingual 3 to 5 minutes, intramuscular 10 to 20 minutes, subcutaneous 15 to 30 minutes, rectal 5 to 30 minutes. Injection, it takes long time, 30 to 90 minutes, and transdermal, it vary around 1 minute to 1 hour. And what are the criteria for selection of route of administration? It largely depend on the characteristics of the drug, the property, its pH, and its state, solid, liquid, or semi solid, whatever it may be. The physical characteristics of drug, the speed at which the drug is absorbed and released, the need to bypass the hepatic metabolism to achieve the high concentration at a particular site, accuracy of dose, and condition of the patient is also important. So here we have done with the route of drug administration. It is the part of pharmacology we have done. Thanks for listening. Have a nice day.